Good afternoon and welcome to our symposium, Leveraging Evidence to Transform Health Systems, Passing the Baton at the Observatory. My name is Matthias Wismar and this is my colleague Dimi Pantelli, and the two of us, we are program managers with the European Observatory on Health and Health Systems, and our role today is to open this symposium, to welcome all you here in the Academy Palace, but also all the people online, because we have a massive subscription to the online part, and which will allow us actually to do a very interactive event today. We all know it. Policymakers are facing really difficult dilemmas at the moment. We have a European health workforce crisis. We have issues surrounding the sustainability of our finance. We have fragmented systems. I could go on like this, a long list of issues and problems. So what do we do about it? And this is what we want to discuss today. Question number one, we want to understand, what do we need to know? And I think it's a very good point in time to discuss this, because we have a new commission, we have a new program, we have a mission letter, but we also have a European program of work with WHO. So what do we need to know to address these challenges? And then we want to address a second question. We want to know, how do we actually make this change come about? What is our role in helping to advance the right solutions? These are two objectives, but then we have a third one, which is very close to our heart and very important for us, because this event today, and we are getting here all a bit emotional, I guess, marks the transition in our leadership. Ewout van Ginneken is succeeding as director, our long-term and founding director, Josep Figueras. That's it from my side. Demi.
Thank you very much, Matthias, and thank you everyone for joining us. Before we start with our special guests and on our journey, we also want to make sure that everyone enjoys today, and that you also, you here in the room, but also everyone who is listening to us from online, participate and give us your insights and your opinions. So we will start with a warm-up question, or rather 9 questions as warm-up questions, which is a poll. Now, to do that, it would be great if we could have the slide so that people can scan the QR code. Very good. And it's about the following very important question linked to the topic of today. Why do you think there is currently such a gap between evidence and policy in practice? Please select the 3 most important reasons. And the reasons that we have shortlisted for you are as follows. Number 1, researchers lack the training and incentives to write for and engage with policymakers. These are, by the way, in a different sequence than the one that I have in my notes, so I'm going to improvise the rest. Number 2, evidence isn't translated into clear, usable, or actionable messages. This is something that we at the Observatory spend quite a bit of time on, and Susie Lesov, who is our moderator for today, is the absolute expert. So whoever thinks this is important, this is the person to talk to about it. Number 3, policymakers are not interested in the evidence and prioritize expediency or ideology instead. Many of us who have worked in the research side of things, maybe we have thought about that as a possibility before. Is that something that resonates with you? Please select that. They are changing, yes, I'm realizing. So, very good. Policymakers are not held accountable for their use of evidence or lack of use of evidence, so they don't have to care. Whether they use it or don't use it, nothing happens. Is that something that you think plays a role? Let's see. Researchers do not communicate effectively and are often out of sync with policy decision-making. So they don't have the skills to write for policymakers, for evidence, to produce the evidence, but then now we're talking about the communication. Evidence is often irrelevant to policy, not tailored to the specific context or needs. So you produce in your research environment new findings that are not timely, they're not useful because they don't answer a policy question at the moment. Policymakers lack trust in research or researchers. This is a big theme for us, trust in general. And obviously, in order for policymakers to listen to the evidence, they need to trust that it is actually correct and the people who are producing it are not biased. And then I think we have a final one, which is Also very close to our hearts. No one pays enough attention to the values and the context that make transformation work. And I know Josep refrained from putting the two words on the slide, the political economy of change. So I'm saying it. This is number currently 7. But overall, I think that was number 9. Maybe I missed one. If I missed one and you see it on the list, you can choose that. I don't know which one this is. So take a moment to think about it. Top 3 that you think apply. You can choose, if you're very democratic, one of each. One fault of the policymakers, one fault of the researchers, and then the catch-all in the end. Up to you. We wait for a little bit longer because we see we have about 150 people who are answering the poll. You can also see that this is definitely more people than we have in the room. So this means that there's people online who are engaging. We had upwards of 1,000 registrations, I believe, for this. So you feel free to feel like a member of a big crowd who is engaging with us today on this. And I think our initial intention was to show the results later during the discussion. Obviously, spoiler alert, that you can sort of tell. But, we will return to the results later during the panel. And I think maybe we wrap up with the poll at this point. And it's my pleasure to introduce Susie Leshoff, who will be our moderator for today. Susie, over to you.
Thank you, Gillian, and thank you, Matthias. Oh, thank you very much. It's lovely that you're all here, and we're particularly pleased to welcome some rather special guests. So if I could ask, please, to join me on the platform, Hans Kluger, who is the Regional Director of WHO's Regional Office for Europe, Marco Marcella, Marco Marcella is the Director of Digital, EU for Health and Health Systems Modernisation with DG Santé at the European Commission. Also needs no introduction. Lisa Maria, would you join us? Lisa Maria Voipul-Pulki is the Chair of the European Observatory on Health Systems and Policies, but also the Senior Advisor of International Affairs for the Finnish Ministry of Health, Social Affairs and Health, I beg your pardon. I would ask Josep and Ewout to join us, but you see that already here, full of enthusiasm and commitment to the discussion that we're about to have. I think that the best thing is we're running a little bit late. If we start straight away with you, Hans. Whenever you have the water organised, Josep, we'll begin. But I'll ask you a question. Hang on a second, Hans, because I think he's going to walk in front of you and give water to Marco and to Lisa Maria as well. Josep?
Managed.
I hope we have a photograph of Josep on his knees in front of the regional director. It's a really good look, I think.
Always on the knees of my partners.
Hans, we congratulate you on your new mandate, and we know that you have a huge job in front of you, and an enormous European programme of work. And I wonder if you could share a little bit of your thoughts with us on how evidence is actually going to help you. Evidence, of course, because we're the Observatory and that's our big interest. How you'll use evidence both to create and to deliver the programme of work, but also to think about trust and how policymakers respond to you. Thank you.
Thank you, Susie, and hello, everyone. I mean, it's awesome to be in my own biotope, as a former director of health systems, and especially you, Lisa Maria. So, Susie, what I would say is that often I go back to the basics, What's evidence? Evidence tells us the policies, the interventions, which work, which ones don't work, in which circumstances, and for who. So it's almost a bit of a no-brainer, a sine qua non, that policymakers would make use of the best available evidence to make their policies. But I'm also reminded of, I think it was John Maynard Keynes who told, some governments hate nothing more than to be well informed, because it's much more difficult to arrive at the informed decision. I think it was a previous prime minister of my native country, Belgium, who told, I know perfectly well to do as a prime minister, but if I do it, for sure it's the last time I'm prime minister. But sadly, we see this in more and more countries, that leaders want to propose quick fixes for very complex problems. I myself, working with WHO, be it as Director of Health Systems or Regional Director, have been always a big proponent of research and evidence, and actually I had commissioned an independent assessment of the regional office capacity on research and our use and analysis of evidence, which was by Professor Martin McKee of the London School of Hygiene and Tropical Medicine. A great report, a very critical report, which we needed. So we have a number of points coming forward, for example, for WHO, to prioritize a culture of publication which puts quality above quantity. It's one point. Or, for example, to sharpen the skills of the staff on what we call realist impact, these lived experiences and action research to catalyze really on the rich evidence coming out of our country work, which then complement the more traditional resources of evidence. If we go to the countries, because our region is always, to be reminded, 53, goes from Greenland to Vladivostok, it comes back often to strengthening basic health information infrastructure for countries to provide international comparable data, or to address together the organized fake news. Of course, I'm in a very fortunate position. The other 5 regional directors in WHO are very jealous that we are hosting the European Observatory, which is true. And I want to thank really you here, the chair, Lisa Maria, and Vesna and Stefan, my home country hosting, right? Lieven de Raad, who is a great supporter. And especially its staff and you, Josep. Really, that's why I told, I'm on the way to Ankara, actually, to meet a new minister there, but by hook and by crook, I wanted here to really pay tribute to you, Josep, to my dear brother. And there are many examples. I remember, and for sure Vesna also remembers, in 2009, the financial crisis, we would never have been able to pull up, really, and bring the finance and health sector together without this excellent evidence of the observatory, the talent charter, but also very important nowadays, if there is uncertain times and there is emergence policy questions and the evidence is evolving. And I think a great example was the COVID-19 platform, which we worked together, that actually was very fast, very transparent, and while the evidence was evolving, it was always on the web, which I think is a great example. So I want to thank you for this, Josep, really, and for we'll have the opportunity for the long-lasting impact that you did. I learned a lot from Josep. The first time I also understood that the observatory is different from WHO Euro, when Josep was speaking in plenary about the difference in Catalonia and Madrid. Then I understood observatory does not have all the same obstacles as WHO.
Oops.
Thank you.
Ants, thank you very much. I mean, I think that sense of how evidence is used really in practice by countries and the range of ways they understand it is so important and so at the heart of what Josep and the Observatory have tried to do. Marco, if I can come to you, Hans has an immense mandate and immense amount to do, and you have a new commissioner and a new commission, and I know you have a huge amount to do. Have you got a sense of how you'll use evidence to support you and your innovation thinking and your plans for the future?
Thank you. First, let me say that I'm very, of course, honored to be here. I mean, our relations with Joseph was very short, intense, but I have to say that I'm very pleased to attend this meeting today. And the second thing I wanted to add is that I'm also very eager to learn the output of these Slido questions. There were quite an interesting pitch in those questions, which will provide also an insights to your own observations. I have 3 main messages to bring today. So, and probably they go in the directions of, let's say, the reflections that you ignite with this slide. Well, the first one is that, as a policymaker, we would typically need that evidence. And I think that we do have a series of words in our own work: robust, reliable, conclusive, clear, comprehensive, and timely. When we do legislations, we have a very articulated way of doing better policy making, and it is there, especially upfront, before we do the regulations, that we do this kind of analysis. But in my role as director, for instance, on health technology assessment, that evidence has another flavor, another element, because it informs, in any case, policymakers on the best decisions from an economic, from a social sometimes technological point of view. So it's clear that sometimes we say more research is needed, yes, but we do realize that the challenges that we are facing do not allow for procrastination, and that is the reasons why I want to say focus on three passages. Well, the first, it is that we live, so we do realize what are the key trends when it comes to collecting data, analyzing data, and decide the way forward in supporting the transformations of health and care. We do realize that we live in an era where digital is profoundly changing the way in which we live and we work, that there is a new kid in the block that is artificial intelligence, generative AI, and that in general the trend is to leverage that data to generate innovation. And for that, we do rely both on, say, having access to data, but also making sure that that data then is turned into competitiveness. You know that now competitiveness is the word that comes from, especially underlined by Professor Draghi in his reports. And for us, we will work, say, in making sure that the sustainability of health systems, which was reminded at the very beginning of this event, it is delivered also through that lever. Now, the second point is that the lever, that the core of Draghi's report is innovation, and the focus of that innovation for competitiveness will drive the work over the next 5 years. It will be at the heart of the missions. I'm sure that you all have read the mission letters of Commissioner Varhelyi. And so the aim of bringing a competitive in a health sector that also drives innovations and preparedness will be the backbone of our next 5 years. And one element of that is the injections into the mission letter of the Biotech Act, by the way. The second one will be on working on completing the European Health Union, and there we have elements that are very important, because certainly we need to complete the European health data space, which will be there for supporting, let's say, evidence-based policy making, but we also need to make sure that the health technologies assessment regulation is not only kicked off in January, but also make it available for bringing the benefits to the society. And the third one is what we work on, say, taking inspirations for the European Beating Cancer Plan, working on cardiovascular diseases. And the third element is that it was mentioned in the work, the accountability. I think that the data and the facts that show that we deliver in terms of health outcomes, in terms of economic impacts or environmental protection, that it is a way, that we ourselves, we work to collect, let's say, discussing the way in which we use the data for policy making is part of that discussion. Sometimes is not trivial, is not easy to extract the right information from the raw data that we will have. Most probably, in addition to creating an infrastructure that allows accessing health data, we also need to build that middle layer that allows us to extract information that can be digested by a diverse population. So for us, certainly we will work, in making sure that we can translate that data into the regulations that we have. And in that sense, let me express our gratitude to the Observatory, because, we know the path, we know that we come from data, we structure that data, we get information, we start making experience on information, and we generate knowledge, and on the basis of that knowledge, we generate insights. And we believe that the work that we have done at the Observatory, that you are doing at the Observatory, it goes exactly in that sphere. So you generate that information that leads to insights that are so important, and we make use of it. And let me conclude with the reference to the latest report that we published on the European, the Health at a Glance, the European report published together with OECD a few weeks ago. This is one of the elements where we clearly see the added value of the work that we are doing with our partners, with you. The two sections that we focused over the past months were on longevity and workforce. But of course, we expect to have additional contributions in relation to what we have in the mission letter, especially on preventing non-communicable diseases or continue working on, let's say, on competitiveness and in general for the work that we are doing on skills agenda. Now, in thanking the Observatory, I think that Joseph, we are very grateful to your commitments, because it is through your commitments that we advance the several policy files, agenda, and specifically the agenda on evidence-based policy making. I think you have done a lot. The work is remarkable. Good luck, Ewan, for taking over this work. And what we can say is that we will continue to learn from this platform, and I hope that it will be for the benefit of the citizens in general.
Thank you, Marco. We had our steering committee over the last 2 days, and so often we were hearing about the analysis, the data, but also the importance of the context and of the qualitative setting, so that if you're going to use those levers for change, you understand in each country how that plays out, how the different players interact with each other. And I think there's so much added value working together. Before we conclude this session, I would like to thank both Marco and Hans for their contributions, but also for their teams, because we work with Natasha Azzopardi-Mascat, with Isabel de la Mata, with Maya Matthews. Your teams have been wonderful contributors to the Observatory, so we thank you both very much, but we also thank all the people that we work with in your divisions, departments, who have really made a huge contribution. And working together, I think, and those synergies between our different organisations is what Josep has always wanted us to do, and I know what Ewout will take forward in the future. So we look forward to working together. And now the poll. Is that right?
Yep.
Can we have the results back up, do you think, please? Well, Dimi, you obviously introduced them too well, because I don't believe that they have really changed. Dimi, can I ask you, do they seem different to you, or they're the same as they were?
They seem a little different. I think that the policymakers seem to be...
Getting it in the neck?
Exactly.
Yes.
I would say.
I think when we posed these questions, there was this feeling that policymakers aren't interested, they don't use it, they're not accountable. But there was also a whole batch of questions, which is, do researchers really actually present the evidence that they need? Are we looking at the right things, or are we looking at our academic hobby horses? It seems to me maybe we have more researchers online than policymakers, and that can explain a little bit some of these differences. But I do think that one of the things that the Observatory has always tried to be is this bridge between the two worlds. And what I'm hoping is that we will now move on to the next section, where both Josep and Ewout will explore a little bit further how evidence actually plays out in practice and what we can do to take it forwards. So, Josep, I let you present.
Thank you. Once, I promise, we'll be on time, and we'll allow people online and here in the room to have a full debate with us as well. So if you can put the slides, please. Start the presentation.
Oh.
So the idea now is, I'll expect you to be back, because we're going to have a debate with you in a minute. I'm sure you can stay here. People have lots of questions about your priorities, about your use of evidence, as well as some of the questions that Ewout and I will now trigger onto you, very much building on these polls that we put that were slightly tendentious, slightly sort of leading you up to certain kinds of questions and reflections. So what am I going to do now? What we're going to do now is what we call getting evidence into policy practice, the art and science of knowledge brokering. Science and the art. Reflections from the less traveled road. We learned very early in the Observatory that the data, the books and the articles did not cut it. Did not make so much of a difference. We learn very quickly, right, Ewout, Susie, that unless we learn how to knowledge broker, we're not going to get very far. And the partners, Lisa Maria, reminded us that we were funded by the impact on policy, not by the amount of books and articles we made. So quite a task. And we're going to be very open here, Ewout and I, and Susie, in reflecting the complexities, the worries, the concerns, and some of the lessons. So with full humility, I'm going to present this, if that moves, of course. If not, I can improvise, there's no worry. Next. Next. I've been bluffing about improvising, and I have a problem. Never bluff, Ewout.
No.
Don't do what I do.
Yes.
Do what I tell you.
Never.
So, I love these 5 T's. I think it does help, although I always forget them, to think through what's very important in knowledge brokering. You tailor, you time, you translate, you trust to transform. Hans, you've been my leader in thinking about transformation. So we tailor the evidence in a way, we try to, that makes sense for decision makers, for their context, for their views, values, and so on. And we time it. Evidence only makes sense when the policymakers cannot sleep, when they're worried, when they're making change. Windows of opportunity have been fundamental. But it's not enough. How you translate it in a way, how you communicate it in a way that makes sense, builds into the decision-making process. And it's interesting, Susie, that in the ranking, trust was the last one. And for us, trust, and I'm sure both Marco and the 3 of you here, Lisa Maria and indeed Hans, we're talking about trust and was the core of our Tallinn conference, Hans. Trust between policymakers and research is fundamental, otherwise nothing works. And all that to transform, at the end of the day, is not, as Hans says, not the what, but the how. So let me say a couple of points and then we'll start a debate here with Ewout and Susie. Just to remind you, by the way, those online, that there are colleagues monitoring what you're asking and will bring these questions later on. The first controversial thing, decisions should be informed by, not based on evidence. Do you agree with that, Marco? It's very controversial with my researchers. Informed by, not based by evidence. So what is our objective, our researchers, our staff? Tell them. If they don't use the evidence to make a decision, bad luck. But have they understood it? Have they understood the relevance for their decision? I'd like you to comment on this one, I'm sure. Focus on client and policy, not research driver. How often, Ewout, we go to our researchers and we say, that's the policy question. They say, no, you're wrong. The question should be this one. No, they're wrong. The policymaker is always right. They've been elected, not us. Mm-hmm. So I'm trying to bias this kind of vote in a different direction. How well do we understand the policy decision-making process? How do we understand the tacit knowledge, the cognitive biases? Our friend Martin McKee always says, context is something we want to standardize. It's messy. No, we want to study the context. We understand how the context affects the decision-making. We engage policymakers. We try. Not easy. It's easy to talk about that, but very difficult. So they design, they interpret, they say, that doesn't cut it. That is not useful for us. The partners do that all the time, right, Lisa Maria? You look at what we do and say, yeah, that's useful, but, Vesna, you say that all the time. I stop. Just give me a second. Very important, I repeat, aligning research on the timing, the windows of opportunity. Our best evidence impact has been when we went to what is here called the quick and dirty. But it's not dirty. It's quick. Rapid responses around presidencies, around decision-making opportunities. Sorry, Susie.
No, I think it's a really useful run through. I mean, these concepts that you have to make the evidence, not change the content of the evidence, but make it fit, package it together so people can use it and understand it. Ewout, you've been doing this for a long time and you're in charge of the next phase. Are there things that you see in directions going forward you want to share with us?
No, absolutely. And well, I recognize a lot of what I hear here, but I also recognize the first bullet point of the Slido, which was that policymakers are not held accountable. And perhaps, what is missing are these structures where policymakers are required. I think some are required to include evidence in their policymaking and decision-making processes. And this is something that would help us enormously. And also that we have, the opportunities to go to them in these occasions and, have a direct conversation to shape the research what we do together, involve them early on. That is when we are most effective, when policymakers really come to us and we identify together these windows of opportunity. This is when I think we are most effective and I think where we can gain more. But we need help from you, many of you, also researchers here, but policymakers, to make that possible. And I also want to emphasize the quick but not dirty is always based on thorough research and evidence. We learned, I think, over the years, we know that many policymakers don't read our big books, but we do need them, to provide and show that we did our work, and also to develop those good short messages that are useful for policymakers and that we then communicate. We know, of course, that not all of you are reading the book from A to Z and perhaps only read the executive summary or some of the key messages. So I think we've been making a lot of progress in this area in the last years to tailor this much more to this audience, to the policymaker.
And without the books, we're not credible, right?
Without the books, we're not credible. Yeah.
And today I'm going to share a secret. Can I?
I don't know, you haven't heard the
I think
secret
Last
yet.
day, we do what we call supply-induced demand.
Oh, yeah.
We know that evidence is picked up when it coincides with what the policymaker wants to do. So we scan, and we see a policymaker wants to do exactly what we have evidence on. That we go, we have the evidence. Use the evidence. We support it. Right? I can say that.
I think you can say that, yes.
Shall we?
Yep.
Next. Translate. This is where, again, we're too good for ourselves today. We're too nice to ourselves.
Yeah, we are.
We should tell people how tough it's been, this business. It's all very easy to say we communicate effectively, we link to the policy process, but the reality is bloody tough. Sorry for the bloody. But we've been thinking about the imprint. Susie's been leading us a lot on that thinking. She's the best writer of policy briefs and messages. And always, Susie, you say, you write this policy brief, what are the messages here? Does it make any sense, these messages? So writing for policymakers in a way that makes sense, is actionable and communicable is not easy. And we struggle. And please look at our briefs, look at our dialogues. What we learn, and that comes from Roger's research in 2008, I think it was, that you have a better chance to communicate when you bring committees of practice. Policymakers working together. They don't pay attention to you, Scott. They pay attention to the other policymaker. But if you're there and enable, put the evidence, you have a chance, perhaps, to get that. So that's so valuable to work with the Commission and WHO because you give us this beautiful platform and our partners, allowing us to bring that evidence together with the evidence that you both provide and be in that process, having you as trusted enablers. About trust. Build policymakers' trust on research and researchers. And here is one of the complexities, colleagues. It's not only about quality, it's not only about objectivity, transparency, and so on. It's political closeness. If you are too far from the policymaker, as we learned during COVID, you are not to be trusted. If you are too close, well, you are under the decision-making of the policymaker. So where should this be, this National Institute of Public Health? How close, how far? How do we keep, Martin, that independence that you so much favor, and at the same time have the trust? This is something that, thanks to the partners of the Observatory, we are everyone and nobody. We don't have any values, we have values, but we don't have any politics. And that not being anything has helped us to be closer to that process. I go quickly there. So embedding that evidence while maintaining independence has been our challenge. And the question to you, when we go to researchers and we say, you should do knowledge brokering, say, no. We do the research, we publish, you do the knowledge brokering. Who's going to be the knowledge brokering? Should we get researchers who have the skills in knowledge brokering? Should we have knowledge brokers? Susie, you've been thinking a lot about that one.
I mean, I think that sense that people agree with the evidence that chimes with what they want to hear. And so when your evidence, there's an open door, but to get people to trust you when the evidence is more difficult. And I see all the time there is a bridge, there's a gap between you need the research, you need the quality, you need somebody who isn't giving an opinion but doing the analysis, but they also have to unpack it. And those two skill sets don't often sit together. So sometimes I think our staff are all remarkable, but they may have initially as one of their conclusions that more research is needed, but that can never be a key message because more research will always be needed. But to help people to know how to pull out what matters and how to present it in a way that people can hear easily. And as you say, policymakers hear from other policymakers. People don't like too much jargon. They need to we learned a lot from Stan, who we worked with on the state of health, which was, don't tell me 66.987% of blah, 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 and that shows there aren't enough nurses. Say, there aren't enough nurses, and then give me the numbers. These things really, we learned from working in a partnership. The way you share your evidence matters. The quality of your researchers has to matter, and how you bridge that gap. And I think, Ewout, that's one you already have a lot of strong opinions on.
Well, I think that we, as research community, need to learn also how to write these papers in a different way. I heard it also, I think, Marco, you referred to it. More research is needed, is something I think that many policymakers are allergic to. Mm-hmm. We have to do better. And also as journals, and I know that Health Policy Journal is making, is doing work in that area, that you require people to come up with very concrete lessons. Often you find, if I review a paper, you find the last line, it says something like, oh, and this may be interesting for other countries contemplating, doing a similar reform. No, spell it out. I think we can do much more if we're pushed. And of course, maybe not always an article is the best vehicle for that, but perhaps a policy brief is. The ones that we are doing are, of course, very helpful. The other thing that I see, I think, has been so important in the work and in my experience, and together with you, Josep, is the trust issue and the trust that you can build with longer-term relationships. Going to the country, organizing a policy dialogue, be in a room with policymakers, taking the time to understand the issues, I think is key in being having an effective impact on them. Yeah.
And we managed to bridge political governments in several countries without being perceived as part of the views. Also, one area that has been difficult to deal with is non-being normative. How do you take the lessons? Again, Susie, Ewout, you are masters on that. You draw the lessons, but you're not normative. You don't say what they should do, ever that. That's what you could do in a particular context that seems to be based on the evidence, and as close to actionable as possible, but never without saying you should, you shall, right?
And I think we also need to look at new forms of communicating evidence.
Absolutely.
Should we be doing podcasts? I think we probably should. And there are other ways that we can do. I think that we need to be open for, and as we have been, and we've been involving a lot, and I expect that we keep doing that.
Your last slide.
Oh, last one. Actually,
it's a relevant one.
I'm going to be facetious. Yes. More research is required. But more research is required on transformation. Hans. Not the what, but the how. Marco, the Commission is now financing a measure, as you know, you're financing a measure project on research on transformation. Dimi. Where's Dimi? It's the political economy, stupid. I know, I'm going to say that. It is the political economy, stupid. This stuff, this figure here, comes from one study that we're just publishing now, in which we're talking about the decision-making cycle. Beautiful. In my dreams, I still believe there is a rationality. Evidence goes into the system, and decisions get made based on evidence. No. There is something in the middle, which is leadership, political will, communication, stakeholder engagement. And this is what we try to summarize here quickly, where we are putting, and today, the partners, they were pushing us further, and Mark, you like that, you're pushing us further into doing evidence on transformation. Understanding the context, not as Martin says, reality happens. We don't adjust for context, we study context. Political mapping, I know, Scott, it's a long time you political scientists, Matthias, you do that. But are we using it to build strategies, to influence, I will not use the word manipulate, but to steer policymakers? And how often we do research on the boring bits, implementation capacity, the political resources, the financial resources, the legal resources. I learned so much working with our partners, we learned so much supporting reform. Reforms succeed or fail, I'm sorry to say that and to be radical, just to provoke you in a minute, we'll have a debate, not because of the what and how good are in content, but how they're communicating, how they led, how they're implemented, how they put in practice. We see that again and again. Great reforms fail because they're not well communicated, they're not well managed. And our job, our shared job, and we've been doing that for a while, but we need to do much, much better, right, is to support, with more evidence and more hands-on, support our clients in transformation.
Yes, and I think we have always been very focused on the what, and we do need to move to the how. That is step number one. But we also need to learn. So implementation science, I think, is the word here that we need to look much more into. How do reforms get implemented and why aren't they implemented? We don't have any indicators that can gauge that process. Something we need to think of. Also, we have a focus on best practice always, which I hate because it's always still very subjective whether something is called best practice. So I would rather say innovative practice, but this is an academic discussion. But why don't we look at failure? I think we can learn much, much more from failure. So I would like to propose a book, Learning from Failure. And we know that we have lots of failed reforms because we collect them ourselves, that we then look at and see where did it go wrong. And I think we can learn a lot from these new approaches. I mean, there's been some work in that area, but we do always tend to focus on the things that work, but they don't scale often. We have very good examples, I believe, of integrated care projects in a certain local context, but why don't they scale? So let's focus there.
Exactly, scaling innovation. And our best chance is help member states not to repeat the same mistakes and do new ones. So don't repeat, make new mistakes. So that's as far as we can go sometimes.
Yes.
Yeah, and I think that sense of how you do the change, how you understand it, why it doesn't work, but also who you do it with. And you did have stakeholders on there, and I know that Vesna, for example, has pushed us very hard to think about social participation, different stakeholders. And it's one of the areas of change. You make policy in more complicated ways, with different groups of people and with consent and not consent. And I think, again, these are areas that, as we move forward, we need to look, again, more widely at, what implementing means in such an incredibly complex world. You have final slide.
Finished.
That means you finished.
Time.
That's absolutely
Believe it or not.
shocking. I'm genuinely surprised.
First time.
What can I
All
tell
these
you?
years I'm becoming better. We're becoming, well, you've always been good. I learned from you, my friend.
Yeah, that was lovely. I don't know if you would mind taking a seat,
Yeah,
we will try and take some questions. The question taking will be a tiny bit complicated because we have a beautiful, beautiful auditorium, but an auditorium, so not so easy. And we have Dimi on one side, Matthias on the other, and we have Astrid and Nathan who are managing the questions online. And I suggest, panel, that we collect a few questions and that you kind of fight for which ones you want best and you ignore the ones you really don't like. And I will maybe prompt you a little tiny bit. So we want to start. Dimi, do you have anyone you want to start with?
We can start. I think for people in the room, just raise your hands. We will stay. Exactly. I saw already from the back, Martin was dying to say something. So I'm starting with Martin. Here, one of our research directors. Martin, over to you.
Before we started this meeting, Josep instructed me that I was to ask a question, and I said no, because there are many other people who should be doing it. And then he said, I'm overriding you, so this is your fault. The question, which I did prompt you about earlier, is to help us to understand the contribution of the writings of Ludwig Wittgenstein to contemporary debates on health systems reform. Now, to help you on that, of course, I've sent you in your WhatsApp the answer to this question, but I didn't know it. I mean, I know a little bit about Wittgenstein and forms of life and meaning as use and so on. But of course, what I did was to put that question into an artificial intelligence program. And it provided really quite a good answer to that. And Wittgenstein did a lot of work on language, which we've been talking about, because the way in which we use language, the fragmentation of knowledge and so on, is actually very relevant. But I didn't know all of that, but I could get the answer in a few minutes. So the serious question here is, are we all redundant? Can I retire? Is there any future? Because we've used artificial intelligence quite a lot during the steering committee of the Observatory. And is there any future for any of us?
So as a second ice-breaking session, which is absolutely not planned, Reinhard, would you please introduce yourself and ask your question as brief as possible? No, I got instructions not to give away the microphone.
I'm Reinhard Busse. I'm also one of the co-directors of the European Observatory, and I head our Berlin hub. And I have been in health technology assessment for a long, long time. And we heard Marco is also responsible for it. And I have the feeling that maybe we also need to go back to the language. Maybe most of us are non-native speakers, and the word evidence is difficult. I think even for native speakers, evidence is difficult. What do we mean? Coming from evidence-based medicine, we would think we need a meta-analysis of published trials. Some people say just a piece of information is also evidence. So what do we really mean? And the other thing, I think what we can learn, what reminded me when Josep was saying policymakers should not decide based on evidence, but for also on other things, that in health technology assessment, we differentiate between the assessment, so really what is there on evidence, what is the state of the knowledge, and the appraisal. And I think that I think would be my question, whether it would make sense to really conceptually also digest this a bit and say these are really different things. And then we could also give the task to the researchers and to people like the Observatory and to the policymakers more directly and make clear who has which side of the coin. Thank you.
Reinhard, it's much better not to hold the microphone because then you have two hands for gestures. But I think it's a wonderful question actually, because it goes back to the basics and to the very fundamentals of knowledge brokering and evidence generation. I saw here...
No, thank you. I saw a question here. Thank you very much, Dimi. Yes.
Thank you very much. Francesca Ligi from the Red Cross. It is super interesting what we have been discussing so far, but I miss an element. I miss the community, not as stakeholder, but as partner in policy making. So the question is on how to bridge the gap between research, also the language, the difficult language for health literacy, not only on health issues, healthcare, but also for health policy making. Thank you very much.
Mm-hmm. That's lovely. Perhaps, yeah. Thank you.
I'm really wondering, can I hold it myself?
Okay.
Thank you very much. I'm really wondering why the focus is all the time on politicians. What are they? Are they more clever than anybody else? Sorry, my experience is not that they are more clever than anybody else. Why are we not making an effort to present the evidence to people that are getting organized? They always have been organized, like young people are organized, patients are organized, and we don't make much of an effort to get the evidence to them so that they would understand better what their requests are to politicians, because maybe us into the research, we are the only people who can translate or broke the knowledge to the politicians. Maybe there are others that can do it instead of us, but we have to bring the evidence to them first.
Thank you so much, Lesna.
If you could pause there, I think before we come to questions online, I think there's two big chunks there. There's something around communities and youth and how you engage with those, and there was something which I think probably between Reinhardt and Martin, not such a strong connection, but HTA, what's assessment, somehow the boundaries between what's the data and the evidence and what's the policy decision maker's role, and whether actually that can be completely replaced by AI. Does anybody on the panel want to come in on either of those areas or to combine them? Ewout volunteered.
Yeah, no, I'm happy to talk about AI. This is something we have to think of a lot these days. And the question that you posed, Martin, whether we are becoming obsolete, I don't think yet. But also, I can still think of many questions that I can ask, AI, ChatGPT, whatever, and it will give me a totally bogus answer. And I'm not even talking about the hallucinations and the things it makes up. So this is actually very dangerous even. Sometimes it gives surprisingly good answers, that's true. But I think if, it bases itself on an average of all the different data points are out there, and if half of them are wrong, the answer is going to be also half right and half wrong. So that's not really helpful. So I think there is still a role for vetting, vetting information. But I do see that it's an incredibly useful tool for updating, or revising language. A tool, really a tool. And I think this is where we need to be, very careful, but we need to stay on front of this. Plus, okay.
I just wondered if Marco wanted to come in because digital is part of your brief, and I wondered if now would be a good moment for you. I will come back, Ewout, I promise. Yep.
See, on AI,
yeah. If you want, you don't have to, but if you would like to, it's your remit.
Yes, no, thank you, because this conversation is very, very, very interesting. Now, I'm coming as a background with somebody that was doing modeling, right? But the reality is not a model. Huh? And so it's very interesting to talk about evidence, but the most difficult questions that we have to address is how do you take decisions when the information is controversial? When we don't have that information, no? So, but however, you have to make decisions. You have to take decisions. And so your observations on the community, actually, this is linked to the community. And I can bring an example, even in a very dry setting, like deciding what is the technical specifications for a QR code. What is important in taking decisions, if I go left or right with that technical specifications, is that we do have conversations with the people that then will use it, or where they have opinions, or where they know it. Because the real question when it comes to we don't have the full evidence is that we do go into that journey in a very transparent way, and it actually helps to structure the process. So I very much welcome your beautiful final slide with the leadership, and because it does integrate these elements. And in relation to AI, I know that this is a conversation that we have to take at some stage, and there is a lot that we are doing, but we are not probabilistic machines yet. Unless if we want to become probabilistic machine, that is okay. But we have to know that what we are getting is the output of a probabilistic machine. And that is a huge step forward in saying at some point we will take forward. Now, we also have to acknowledge that whatever our power is, mental, we will never be able to digest 3 gigabytes of data in 1 millisecond. So let's make the best out of it, knowing what are the reflexes that we have to have in taking decisions on that data. Sorry.
Thank you. And I think that, that sense that there isn't an opposition inherently between using AI and being community-led and involving people. Lisa Maria, you come from a country with a strong tradition and speak for the partners. And Hans, which one would you like to say? I don't want to push you into talking about that end of it, but I think it would be interesting to hear a little bit.
Oh, yeah. Thank you so much. Thank you, first of all, for the very wonderful presentations and challenges that you express in a very efficient way. I think we are here talking about really the bread and butter of the observatory, so what the observatory is all about. But two things came to my mind when I was listening to the presentations, and then the questions, actually 3. First of all, how do health systems actually develop or evolve? We talk about reforms. Are they revolutions? Sometimes health systems, I would say quite often, health systems actually develop by evolution from inside. And inevitably, there are huge impacts from other sectors, as we usually say, sometimes technological developments like AI, and they actually induce even revolutions inside the health system. Are we ready for that? And when evolution is the case, are we interested? Do we speak the same language than those who work in our health systems, professional groups? Not all are health professionals. There are many other professionals groups that work inside our health systems. Are we interested? Do we pay attention? And are we ready to adopt what is being presented to us from inside the health system? Yes, I think we often are, but sometimes we speak different languages, and then the message just goes by. And the other issue that came to my mind was that we speak about learning from each other. Learning from each other is a skill that can be developed. We don't get that at birth. We have to learn to listen to other people. We have to learn to do dialogues with people who come from different cultural, scientific, professional backgrounds. And I think that the Observatory has given us good examples of how to do that, but we could even develop further our ability to learn from each other and understand the context. These were some of the ideas that popped up when I was listening to you.
Thank you, Hans. You have spoken many languages and how people understand. You have really a large portfolio of countries and stakeholders, so communities and doctors and politicians and citizens. You don't have to speak now. I'm trying to stop Josep till the end. Hold him till the end. But we can get more questions. But anything you'd like.
So I'm happy to say something, Susie, because we have a great opportunity, not at least for technical excellence, evidence and relevance. Because a couple of weeks ago, the member states, right, including Vesna, Lisa, Maria, gave me an unanimous mandate for a second time, 5 years, and now my only KPI, key performance indicator for the next year, is to lead a consultative, innovative process to develop the vision on health and well-being for the pan-European region for the next 5 years. The European Programme of Work number 2, where we need everyone very much on board. It will be very participatory. It will be constructed actually around a number of hearings, not around health issues, but actually mega trends, so that there is a co-ownership, what we see already from other sectors. So the 5 mega trends, we're going to have hearings. We'll start the 22nd of January. Next year is on the silent epidemic of chronic disease and mental health. It's not only a health business. The second one will be health systems of the future. I mean, actually, it was in this room, I believe, that with Deputy Prime Minister Frank van den Broeke under the Belgian EU presidency, we had this great event on the biggest crisis that we face in health, the health workforce, for which we need very much digital tools and a reorganization of the service delivery, which actually I'm going to discuss this evening with Commissioner Oliver Varhelyi. Still, the third hearing will be on the climate change and health, 27 February. I'm going to launch the Pan-European Commission on Climate Change and Health to elevate the health sector leadership, together with the charismatic previous Prime Minister of Iceland, Katrina Jakobsdottir, in a very pragmatic way. Then the fourth hearing will be on the demography. Again, it's not a pure health issue, plunging fertility, rapidly aging population. And then the final one will be on health security and emergency, which we had a very, very constructive debate this morning with Commissioner Labib, who was telling indeed there is a deficit of trust there with the Global South after the COVID-19 vaccine inequities, which we have to try. And then there will be 2 special initiatives. One is primary healthcare. I used to think there is no magic bullet point for all the challenges we face. Actually, there is one, and it's called primary healthcare. If it's well-resourced, digitalized, linked with community resources, and put at the heart of all policies, primary healthcare can tackle all those challenges and even be the gateway. And the second special initiative is something that bothers me a lot as a physician and a father of 2 daughters. It's to combat violence against women and girls. Yeah. The statistic of 1 out of 4 scares the hell out of me. 1 out of 4 girls, before they turn 20 years, will have at least one experience with intimate partner violence or non-partner sexual violence. And again, I'm very, very grateful that Commissioner Labib also committed very much to join the efforts, because it's also in her portfolio on equality and women's rights. Finally, one of the things will be, in this consultation, it will up to 2030, SDGs, but with 4 side scenarios up to 2050, because it's time to go beyond 2030 to 2050 NCD resilient region. So Ewout will have a lot of work for you with support of the partners. And obviously, what Vesna from day one, I knew her, was telling me, youth for health. Youth, very important. The communities. I mean, ultimately, it was the Tallinn conference which put trust and co-creation at the heart of the health system transformation, with patients and with healthcare workers.
And I think it's so interesting that you're using the term hearing for the things, because it chimes so much with Lisa Maria, what you were saying, that we need to hear and hear all sorts of different people. Astrid and Nathan, can I ask you if there are questions online? And then Dimi and Matthias, I'll make you run around.
Yes,
Astrid,
thank you, Susie. We have a lot of questions from the online audience, and I want to firstly thank them for sending in the questions. I'm gonna combine 2 questions to begin with. So, for complex health policies, evidence does not speak for itself. We have to speak for it. Can you comment on the art of interpreting experience for countries? And actually, there was an addition to this question, just for clarification. The context is the non-HTA type of policy questions where country experience is not conclusive, but must be interpreted. And to combine with that question, we have a question on how do we communicate policies effectively in the age of truth, social, Trump's social network, TikTok, Instagram, Blue Sky, and X, even though many are leaving. And final question, just a second. Do policymakers in different bodies, so the Commission, Executive versus Parliament, understand the role of evidence differently? And does EU national level differ? Thank you. I think we'll start with that, and maybe we can come back for a second round.
Yeah, I think there's some really... Panel, would you like to take one of those now, or we collect some more from the floor? Because for me, there's a question around communication in the modern world. This is a question about the levels and whether there's a difference in EU, and who interprets and speaks for countries and shares the evidence. Eva, Josep, I allow you.
Yes, thank you. There were a couple of orphan questions from the past, from the first round, that I can intertwine to this very good question about the complexity of health policy within the country. How do we do that? Well, badly, as well as we can, with lots of humility and respect to policymakers. And Reinhard, linking it to you, you should answer the same question you did. We need to start by understanding that this hierarchy of evidence about our cities being there and what we do at the very bottom has been very harmful. Because what we do cannot be put in an RCT, unfortunately. And we need to have more credibility of this more descriptive, this more political analysis. Political analysis is very credible, colleagues, I know. But we need to have all this evidence, not RCT, in there. And that relates nicely with this question about what do we do with complex situations in a member state. The first thing we do is to say, we bring other policymakers on the room that have tried to do the same thing under different context. And what we do is we share what was the key for success in the other country. Where were the elements that was successful? Always starting with the question of the country, understanding with a tacit knowledge of Director General, of the Minister, understanding the biases. You never teach or talk to a minister, you listen. I know that sounds very straightforward, but some of us, some of you in the ivory tower don't know how to do that. And one of the problems we have is have good researchers that come on the road, not from the ivory tower, but start listening and tuning in to that particular complexity, understanding all these other elements. There's nothing I dislike the most to say, I know what you should do it. In my country, we did it that way, it was perfect. It's irrelevant. Why did it work in your country? Where were those elements that could be possibly applicable? How do you translate that? How do you disseminate? How you move that experience from context to context? So a lot of our debate, and we don't have the solution, is very much in trying to do that. I'll leave the communication complexities to someone else, but let me say something on Vesna. Vesna, which relates to the literacy. Over the years, you convinced, you prodded me, you bullied me, and eventually I agreed with you. It is with civil society we can make change. Civil society stays when policymakers change. Civil society makes policymakers accountable of decisions. And I know of civil servants, Vesna, that then give that evidence and empower that civil society, right, to then things that civil servants cannot do, that civil society would do. So in our obsession for change, we need to do what Vesna is telling us, and we're doing much more now, work to empower, provide evidence to that civil society. Something I know that both WHO is very keen on, and so is the Commission. And Vesna will remind us, not enough. To us, not to them, to the Observatory.
There is a question on TikTok on how we communicate in the
Leave that one to you.
No, it doesn't have to be answered by the Observatory. Does anybody under the age
Maybe
of 50
to Marco,
like to take the question? And the other thing is this was a complex thing about how evidence is understood at different levels of the Commission, different by politicians and stuff. Do you have a reaction to that, Marco?
I have one reaction because since age technology assessment was mentioned twice, probably that is a good example. Now, health technologies assessment per se, it's complex and it has, you all know, so there are several dimensions. Let's put it that way. The exercise we are doing with the health technology assessment regulation is quite an interesting one in that sense, because it is a mechanism, to harmonize at least the way in which we look at the clinical assessment, clinical evaluations of medicines or medical device. Do we know now how this will unfold and change the way in which health technologies assessments will work in Europe over the next 10 years? Probably not to the point that we can, do the math, but certainly there is a vision. But it's a journey that we need to do together with the member states, and there is a learning component into it, so it cannot just be totally schematized. So, and what I found very interesting, and that is actually my answer to that point, is that when you look at the Article 1 of these health technology assessment regulations, in Article 1 it says we do joint clinical assessment all together. So essentially we take a new drug for cancer and we do this assessment, generating or looking for evidence and creating a report. And it says, Article 1, then it's up to the member states to take it forward to the best way they feel and they wish. And I found this very interesting because in a way it tells us it is a journey. And so in 2-3 years' time, we will see how these unfold. So we know very clearly what the direction is, but the learning process will come as we go ahead. So it is an interesting exercise to see how we go from evidence to changing into the economics of health technology assessment in Europe.
These were your hands.
You first, this time.
Thank you. A point, Susie and dear colleagues, on sharing according to local context. We kicked off last Friday the Tier 3 of the Pan-European Leadership Academy, which starts with the EU CMOs. So we had 21 CMOs to create this transformative network of healthcare leaders, actually to exchange, you talked about failures, Ewout, both enablers and obstacles. And my co-director, together with me, is Professor Walter Ricciardi from the Catholic University of the Sacred Heart. And actually, my other friend, Dr. Clemens Aura, I see, was also part of it. Remember, Clemens, in Rome, one time we had this. How do you make decisions in uncertain time? How do you do risk communication? Because as a CMO or a Secretary General, it's also a very lonely post. So it's not a training, because these are the people who stay in the health systems when ministers come and go, but actually exchange. And the first physical coming together will be 10 and 11 March. So I thought to give this, it's very relevant to this discussion.
Lisa, thank you, Hans. Lisa, did you want to come in as well?
Well, a little bit different issue, because I think that there was a question about how to interpret or mediate evidence in case that the evidence is inconclusive or even contradictory or non-existent. And, well, in the best case, we can collect the experts in a roundtable discussion, for example, at the ministry, and try to find a consensus. And if they are all wrong, then we usually say that the beauty of the scientific community is that it corrects itself over time. But usually we don't have that time. And we don't have time to gain more evidence, do more research. Sometimes we do, but quite often not. And who is then to say, give the advice in this kind of a situation? It's quite a lonely post, and I think that quite many of us here have some experience of this kind of situations. And this is also, I think, a dilemma of the public health institutes, because sometimes they are the ones who have to say, be honest and say there is no evidence. But still you are there as the expert who usually advises the minister. And then this becomes a question of trust. That since you are the expert, we trust that based on whatever you have at hand, even inconclusive, you give us the best educated advice that you can give. Okay, you can live on this for a while, but not forever, because then you have to go back and do that research. And being there in between these two worlds is difficult, but it's also fascinating. And we were talking about youth, and I think how can we educate and market this type of a career to young professionals, bright minds who are interested in health systems and policymaking?
May I say something on uncertainty?
May I add one thing? I mean, the observatory outputs are quite often used in education, in teaching.
Exactly.
And I think that this is one of our assets that we might want to advertise a little bit more.
Thank you, Lisa. I was going to say that both Ewout and Josep want to contribute, and we should do age before beauty. So, Josep, would you like to make your contribution?
That's abuse, that's ageism. No, I love what you said, Lisa Maria. And I'm going to have a go at researchers, sorry, because there's a bias here. Researchers say policymakers don't deal with the uncertainty. That's not true. Policymakers deal much better with uncertainty than researchers that say more research is required. Policymakers are used to deal with uncertainty, and they only want researchers to tell them how much they can say, exactly as Lisa Maria said. And second misnomer here, during the COVID crisis, the best policymakers were those who were able to communicate uncertainty. So it's not true that you go to the population having to be certain. The population trusts those policymakers and say, Angela Merkel, I really don't know. That's what I know. So there are many, many of these topics, that myths that are not really true and we need to address. Uncertainty is what policymakers do, and population can understand uncertainty. We have to be much better at that and not to have a go at the population or the policymakers. Wouldn't you agree?
I agree totally. It was exactly my point.
Oh, sorry.
No. It happens all the time, actually. No, this showed our, the shared history we have in these kind of situations. But I had another reflection, if I may.
Please, and then we'll do one more round.
Yes, which was, you said something very interesting, Josep, about bringing in another policymaker from another country to talk about their experience. In my view, that has been one of the most powerful, most effective policy brokering, knowledge brokering that I have seen. And that's something that we should also really invest in, that already went through the process, did also an evidence-informed process, and then are willing to share. There's immediate trust because the policymaker from the one country can assume that the other person knows what they have to deal with. I think it's very helpful. And I know that we all have been dodging the question on social media, which is just very quick reflection. It's just really very hard to do something about. Should we be more active on social media? Perhaps. But maybe we should target much more on local leaders, that kind of people who influence and have a real impact in their community. Some countries have tried working, with other influencers and tried to get an influencer to give certain messages. But what then happens if this influencer goes rogue and starts to say all kinds of crazy stuff, which has happened as well in some countries. So this is just a very hard one that we need to tackle and think of, a lot how we're going to solve this.
I think it is an interesting and a difficult one for the observatory, because it's very much about evidence for policy, but also for the institutions who are interacting at all these different levels with a population that is clearly very troubled by and disengaged from political process. Sarah, we had a discussion earlier, and there was a question: you transfer evidence from one country to another, but not all countries have the same values, and how you adapt and how you manage evidence in these complex situations, I think was it Ingrid? I don't. It's very complicated. Are there more questions? Yes.
Hi there. What we were talking about was applying the experiences of one country to another, because what I find when I attend steering group meetings is a significant sense of catharsis, frankly, because I find that my colleagues all around the continent are experiencing very similar challenges to myself. This is the similarity is striking every time. However, when we are making our decisions, yes, evidence informs what we're doing, but really importantly, and in an unquantifiable way, is that values component or expectations of a population. And what we were discussing was that we are finding that the population's expectations of public services are changing rapidly. The way in which they interact with institutions, or they trust institutions, is changing rapidly, which probably needs to factor in somewhat into how we address evidence, or how we think about how we approach problems. So the way that we solve integrated care now is probably different than how we may have approached it 5 or 10 years ago. Mm-hmm. So I think that was the discussion we were having, if I'm not mistaken, which is more explanation than anything.
I know that Gastein this year was on democracy and how people understanding health. I wonder if Clements or Dorley, you wanted to say anything here. Run, Matthias, run like the wind, like the wind.
What can you say?
Thank you very much. I would like to remind all of us here in this room that we are experiencing, we are going through times of dramatic democratic delegitimization of our democratic institutions. I don't want to be too strong on that, but this is so strong. Look at the elections around the world. In the democratic countries. Look at the US, look at Romania, look at France, look at Austria, etc., next year in Germany. We are experiencing this delegitimization of our democratic institution. And that has something to do with your first point in the first survey here. We are living also in times of bad politics. Bad politics. And why is that? Because politicians, many politicians, not all, I know wonderful politicians, but many politicians don't pick the issues which people care for. And in the healthcare systems, people don't care about competitiveness, Marco. If van der Leyen wants to talk about competitiveness, she will fail dramatically politically. They don't want to talk about innovation. They cannot hear that word anymore. In health systems, they know that the doctors are not there anymore because there's a shortage of doctors and nurses. The waiting times are longer. The fragmentation of our services have led to a point that patients are left alone. We all know that. We know that in this room. But this is what people feel. That's what people feel. And we are so detached sometimes from that, what people feel. This is my point. And whatever you can do to close this gap, and you guys had wonderful answers already there, but this is what it is about. We have to fight the delegitimization of our democratic institutions, and you are part of to make it better.
Thank you so much, Clemens.
Thank you, Clemens. Rather than coming straight back to the panel, does anyone have a contribution that, yes, Dimi on this side, and that chimes with that? And I think that, you know, Clemens isn't blaming you for these things. I think he's raising things you might really like to comment on.
I think
I know that. I was saying that. Dimi.
If that's okay, we'll take 2 short points from this side of the room. We have Boris and Nick waiting, and then I give it back, just for ease of...
Super, and then Matthias, if you want to...
Briefly and introduce yourself.
Hi, Boris Azaiz from MSD, known as Merck in the US. Thanks a lot for the great presentation and all the subtleties of bringing evidence to policymakers. One point that has been somewhat touched upon, but really is where the main hurdles exist, is the pressure points on policymakers. I mean, evidence can be certain, uncertain, ambiguous, and so forth, but I assume that policymakers receive it with 2 things in mind. First, how the public will receive the decision, and how, you know, it might impact the political success of these policymakers' parties. So what I mean by that is that first, obviously, you have the pressure point of fake news, and we can see that even for healthcare professionals, the issue of, you know, vaccination is not a given. Huh? And second, there's also political expediency, and maybe here I'm a bit provocative, but as a French citizen, I was first told that masks were probably not necessary at the outset of COVID until, you know, stocks were gathered and masks were available, and then suddenly they became mandatory. And obviously, one thing that, you know, Joseph mentioned is the issue of trust. And I think, you know, far from engaging in social media or educating the public and so forth, I think the trust is built by policymakers coming clean after having said something that proved wrong, because otherwise the trust will never be built upon, and you without it, then your evidence goes straight to the bin.
Thank you, Boris.
Thank you. Is this okay to take the second point of this?
Please, and then Matthias, and then we'll come to Matthias' side for 2.
Yes, thank you very much. Ewout, Joseph, thank you very much for these important lessons about implementation and transformation towards the country and the ground level. But given the magnitude of the challenge we are facing, looking at the Observatory, WHO and the Commission as part of the system, so how would you assess what is needed to make this engine work for transformation in Europe, given we have the instruments, the policy in place or working on an EU Commission level, the body of knowledge we have at WHO, and the evidence. So how would it make, is it sufficient what we're doing currently? And what's the message to all the underlying networks in Europe? How can we make this transformation happen? What is your assessment?
Thank you.
One more question?
Please, yeah.
Yes, thanks a lot, Caroline Cossongs, Director of EuroHealthNet. Knowledge brokers are key indeed, and it's quite of an art, and I don't think that academics are the best skilled to do that. And I know that Observatory is instrumental in doing this. I think EuroHealthNet are also trying to do this for health promotion, disease prevention, and tackling health inequalities. Knowledge brokerage is also crucial if you talk about health in all policies. But my question to you is, I think we are too few. Where is the profession of public health advocates? We talked about civil society organizations, but I'm very concerned because increasingly they have more and more financial difficulties. We talked about the National Institutes of Public Health, but to be honest, I don't think they are the best advocates somehow politically. Who can do this work? And what is your vision on that?
Thanks a lot, Caroline.
Thank you, Caroline. Anything else, Matthias, you want on that side?
No, there's no more hand showing.
Come to a minute.
Oh, well, there's one more. That's Susie, okay?
Okay, doke, yeah. And then we came back to the panel, and then we do finish online, yes.
Thank you so much.
Hi, good afternoon. Anka Toma from the European Patients Forum. Great debate. I had 2 thoughts during this. Well, I had many thoughts, but 2 that I would like to share during this debate. One is more often than not, a good decision is not the one based on the best evidence. Sorry, not trying to undermine you here, but the one that is most aligned with the values and the principles of those making the decision. This is my principle, if you want. Because, as you said, there is never perfect evidence. You don't ever make a decision based on perfect information. Mm-hmm. And so I'd like to take a step back from the importance of evidence and a step a little bit closer to the importance of values. And to establish as a, community of practice, people around here, people who work in health systems, what are the values that drive us? What are we trying to achieve? And that brings me to the second thought. Leveraging evidence to transform health systems into what? Have we defined? Do we have a definition of the health systems that we want to have? And shouldn't we start with that? And then work it backwards to where we are now and through what needs to happen, and gather the evidence for that. Thank you.
Thanks, Anka. Good point.
Thank you. Panel, so much there that it's difficult to say to you directly what would you like to pick up on, but really rich about democracy, about trust, about being honest and open, about how you broker knowledge, about what you find evidence for. It's like a smorgasbord of very good things. Does anybody want to volunteer to is there something you want to speak about or reflect on? Because I don't know how to direct you. Marco.
Well, no, so I, having actually worked for more than 10 years with the visions of translating what somebody can call innovation into clear benefit for somebody else, I am not totally sure that there is a dichotomy between innovation and the needs of what citizen wants. Probably is the narrative that you were talking about. If you talk the narrative, then okay, fine, we can discuss that. But technically, if you take the drivers of changes that we see now, I mean, even, I was this morning looking at one of these reports published by FPA, and it's not different from any of the documents that we see from the Observatory, where you put the climate change, where you put aging and the populations, where you put the workforce shortages and who is working there. By the way, the number is going up we had just a meeting with JRC exactly on that. So if we know the trends and we can elaborate on the evidence, it's clear that the path is evident. So if you want to change something that it's there, you will need to introduce innovation. And that innovation may come from different actors and from different spectators too, or those that are decisions makers. And even digitally, that may certainly contribute, but eventually what counts is the change management process that is attached to it, and that may take the things that can go either good or wrong. So I don't want to, on democracy, I mean, I don't enter, but on the role of all ourselves into innovate, that is something, it's a discussion that it would be very good to take place, because in a sector where different voices coming from different vocabularies have to take decisions, that per se, it is a challenge that requires a good understanding of how do we promote innovation. Because I'm pretty sure that if you put, even in the world of digital, if you put the digital people and the lawyers that decide on data protections and those that decide on ethics, coming up with an innovative process per se is very challenging. So, okay, well, that's what I wanted to offer on the narrative. But the narrative, I take the point. Yeah.
Ewout, did you want to use it?
I can, or
I'll follow you this time.
Yeah. So we had
age before beauty.
So we had two questions on transformation, which is of course something that we are really working on, and not always have the magic bullet here. So the question was, how can we make transformation happen? And the other question was, transformation to what? And those are two really good questions, obviously. So what we know, there are good examples out there, pockets of innovation, very good models of care, integrated models, holistic, etc. They don't scale. And it's true because, you cannot just implement that anywhere. I think any implementation process needs to start with a broad consultation in the community, with all the stakeholders in the community, to build a broad consensus and a shared vision. That's really important, the shared vision of the system you want to have, and then work towards it. So that is just the beginning of it, of a long process. It involves many other factors, and also something that is, we write about in certain briefs. And we can give you more details on all the other things and all the other levers that you can pull. But that's, to me, is the starting point, to really, this start in a community. That's also a word we've heard before, and a shared vision, and then you start to work towards that.
And knock on the door. Knock on the door. You talk to European members of parliament, and you say, what the heck, why are you doing that and the other? He says, where are you? The lobbyists are here, the commercial companies are here, the pushing people are here. Where are the researchers, the networks? I know, Caroline, you are on the ones, it's always there. But what are all these other networks? Knock on the door. And yes, no one wants to be a knowledge broker. But you know what I'm thinking? If we had, instead of the research impact incentives, we truly put policy impact incentives, researchers would worry a bit more on knocking the door. But the part I'm fascinated about is the values that Anka and Sarah both mentioned. Values, Sarah, you're right, expectations change and move. So how do we manage? You and I discussed that and struggled with that many times, Susie. How you manage in this moving and shifting element? Let me tell you an example. Two countries which are neighbor countries, whose names I've forgotten, had the possibility to talk about private hospitals with one minister one day, and funny enough, the next day with another minister. They happen to be of opposite political parties in the spectrum. We talked about the same evidence. One was for it, the other one was against it. One wanted to start at the model, the other one was asking me how we kill the current model. The evidence is the same one. So what do we want? We want a neutral platform. Gashtan is beautiful. It's a great, I sound like Trump, but Gashtan is beautiful because it provides these kinds of platforms which are neutral, but the values are obvious. So what are we doing? We're saying, this is the evidence, but minister, if you believe private is better, so be it, because you've been elected. Because you're elected by a population that believes, regardless, and now it's going to be very controversial, but anyway, my last symposium as director of the Observatory, I am happy to put explicitly on the table the value of private, the value of individual versus population, if that politician is being elected for that purpose, even if the research doesn't show that actually you get more efficiency, more equity, or wherever. So the key there is transparency. Let's put it on the table. Let's debate it, but explicitly. And let's separate what's the evidence against a series of objectives to the values and trade-offs you give to these objectives. It's easy to say, very difficult to do. And our colleagues in Gashtan show us. But when you provide these kinds of neutrality, these kinds of spaces where you can talk of evidence and then you can show your values, I think is one of the ways forward. But a lot of fun, that's why I love this job.
Thank you. And I think what's lovely is you're sitting next to Hans, who is able to, of course, do evidence, but can come with the values, can come with what is right and what is wrong, and that the Observatory has a slightly separate space, and that is not our space, and that belongs to other people. I think we had, I asked Ingrid and Nathan's permission, with my apologies to everybody online, we won't have another round of questions because we want to keep moving on. But we talked about who are the knowledge brokers. Can I just ask the staff of the Observatory to stand up for 1 second? Because there are quite a few of them here, and they are knowledge brokers, and we're very proud of them. So just for a second, you don't have to do anything, but just stand up. Well done, you. Thank you very much. And I know that Josep and Ewout and all of the partners are very aware that we talk about the wonderful things the Observatory does, and you are the Observatory. So thank you very much from all of us. I think now we have come to the point where the chair of the observatory will be allowed to speak. It's kind of a handover moment, so Lisa Maria, I hand over to you. Thank you.
Thank you, Susie. Excellencies, colleagues, dear friends of the European Observatory on Health Systems and Policies. On behalf of the steering committee and representing all observatory partners, it is a special pleasure and great honor for me to say a few concluding words in this very special symposium and a unique moment in the history of the observatory. As you know, the observatory's vision and intent is to generate even better knowledge and evidence and to make it more accessible to healthcare professionals, managers, and policymakers, a topic that we have been discussing here for the past 1.5 hours or so. During the last 2 days, the Observatory's steering committee has convened here in Brussels, and in addition to the normal business, we have inevitably reflected on the past, present, and foreseeable future of the organization. This has, of course, been the final official appearance of Director Josep Figueras in the steering committee. However, I believe not the last service to the observatory, as yesterday the steering committee awarded him the honorary title of Director Emeritus. The observatory's successful transition to the era of the new director is, of course, a special moment to look ahead and confirm our willingness to deliver and to learn from each other as well as from our stakeholders with confidence and trust. What does the word observatory actually stand for? It is a building, place, or institution whose primary purpose is to make observations and command a wide view. In some instances, this viewing platform is also turning the experience back to the observers. Well, basically all observatory outputs are public goods. Why? Because we are convinced that in addition to health being a value at its own right, fit-for-purpose health systems are cornerstones of sustainable societies and bring significant co-benefits to other sectors. And I personally believe that the observatory partnership model can also be a trust generator between sectors, political actors, and various interest groups. The theme of this symposium has been leveraging evidence to transform health systems, passing the baton at the observatory. The governance manual of the observatory defines the role of the director as follows, and I quote, "The director is accountable for the activities and outputs as a whole. Horizon scans provides intelligence, including on emerging issues, formulates plans to meet the priorities established, including plans for resourcing work, formulates plans and approaches to knowledge brokering, maintains effective links with other organizations working in related fields." Quite a job, but also a dream job, as Josep has described it. Then, what does the word baton stand for? There are several meanings, but I will pick just 2. In sports, relay running is a type of running race in which athletes compete as a team rather than as individuals. The ultimate goal of the relay is to move the baton around the track and across the finishing line in the fastest way possible without getting disqualified. The exchange zones are 20 meters long and are preceded by a 10-meter acceleration zone. The receiver begins running in the acceleration zone, but the baton can only be passed within the exchange zone. I think that we have now reached the exchange zone of the observatory's baton after a very smooth and effective acceleration zone. In music, a baton is a stick that is used by conductors directing an ensemble of musicians. Professional conductors often have personal specifications for a baton based on their own physical demands, personality, and experience. A conductor's role is to support the pace and structure of the musical piece, but he or she does not produce a single sound without the musicians. Conducting an orchestra is a very visible activity, but the secret of success is the concerted action of the performers under the director's baton and the appreciation of the audience. Needless to say, this is very much true also in the case of the Observatory's baton and outputs produced under its leadership. We also recognize that, as in different types of music, health systems are deeply rooted in their own cultural contexts and hugely influenced by the wider European and even global environment. We have been discussing here that European society is facing significant challenges, all of which have an impact on how health systems work and what they are expected to deliver. Dear Josep, dear Ewout, ladies and gentlemen, and I said I might become a little bit emotional at this point. Transparency is central to the Observatory's policy and supports accountability to partners, member states, our professionals, and the public, who at the end of the day they are our audience and beneficiaries. Let me cite the manual again. Accountability and added value of our work is based on technical excellence, of course, drawing on the best established expertise and work across disciplines, efficiency, responsiveness, timeliness, inclusiveness, and reflecting the different perspectives from different countries and backgrounds. With these words, I would like to invite the steering committee's two co-chairs, Stefan Eichwalder and Vesna Chestin-Petrick, to the podium to mark the transition of the Observatory to the new leadership of Ewout.
Well, the baton of the Observatory became bigger and bigger and bigger. So if you want to run fast with it, you have a problem. If you want to conduct an orchestra with this, you do have a problem. But it has two advantages, my friend, because we are friends. One, don't pretend that you can conduct the orchestra of the Observatory. My only claim of fame is that I chose the best musicians, and I have a sense of what they can play. I cannot play anything myself. So the best I can do with them, Ewout, is try to follow what they do and look as if I am a conductor. So I move like that. So I look at them, if they go in a certain direction, they like to play together, so you're lucky. Yeah. Then I look as if so that's a good one for that kind of thing, but don't pretend too much conducting, truly. The second is, if you want to run with this, you won't get very far. But it has two advantages. One, you cannot run on speed. You cannot win on speed. Therefore, what you have to do about strategy. It's like the turtle and the hare. You run races, you win races by lots of strategy, because with this you cannot run. But secondly, it's so heavy that you have to hold it with your staff. You have to hold it together. You know that old saying that I dislike it because it's been made so many times, but this time I'm going to say it. If you want to run fast, go alone. If you want to go far, run together. And this is the only way to carry this baton. So maybe if the partners of the Observatory, the two organizations, and my deputy director can join in the middle and help me. Please,
Hans. Yeah.
Susie.
We all. Okay, we can fit in. Susie.
Are we good? Oh, God.
There you are.
Well, wow, thank you so much.
I didn't have anything to say anymore.
So when this was pointed at me, it also had the shape of the barrel of a gun. And already when Lisa Maria was talking about the accountability and on the role of the director, I saw some of the staff here, my colleagues of the Observatory, smirking at me. But your words are, you know, so important to me. First, I would like to also thank you for coming here and, you know, having this special moment with me here today. Marco, Stefan, Vesna, Hans, Susie, Lisa Maria, Josep, you of all people, you know, you've supported me, and you know, I'm so incredibly grateful for you. That's hard to describe. There will be speeches later where I'll do an attempt how much you mean to me. I'm very aware that I'm in charge of a beautiful orchestra, and we're going to make music together. But I also like what Lisa Maria said about running together, and I think we will run together for much more, Josep. And I know that I have your support. That means so much to me. Also, after you're no longer director, you will be helping me, and that gives me, you know, a lot of courage and confidence that I will master. And now this thing is breaking up as well. So, thank you very much, and thank you everybody for coming for this special moment, and I hope to have a toast with you later. Thank you very much.
I'm not allowed to cry, so it's very important that I don't. We're going to have a reception, and I would like Matthias just formally to close. No, I'll close the meeting, but I'd like to thank Matthias and Jura, who really have done an extraordinary job to bring everybody together today, and of course to everybody who came, to all of you, and for, yes, I won't say anything. Jura, would you like to come and explain about the reception?
I would say bye-bye to those that have been online with us. Thank you very much.
Yes,
sorry.
I'm so sorry, I forgot.
Sorry you cannot join the reception here, but thank you for being online.